Hello everybody, my name is Alex. I'm co-founder of Amass, and in this video I will show you how business development or investment teams can use the Amass platform to get a very quick overview of what's true around a certain target indication, what does the clinical landscape look like, and thus make better decisions. So imagine you're going to a conference, you're talking to 50 startups, you're coming home with all the slide decks, and it's just very hard to make sense of what is the competition doing in that space. Should my team be following up with which opportunities? Where should we put our time? Where should we invest our time? One of the key reasons for this is that competitive landscapes around especially busy indications are really hard to understand. And also the information that you get in the slide decks, you can't really trust that everything is there. So you need to do your own independent research here. And this is where Amass actually helps. So let's jump in. So I'm now on the Amass platform. And for this task, I will go to templates. I will go to our pre-made templates and open our clinical pipeline matrix template, which is exactly made for this purpose. So this template works by essentially having a placeholder for the target indication to investigate. For this example, I will use endometriosis. And you will see here, now that I've filled in endometriosis is put into various places in the template. Let's just look at the template and what it's doing. So we have set this up based on our experience working with our customers at Amass, having these business development, investment decisions to make. And the template really looks at different facets of the problem. So for example, understanding the market and the standard of care, but then also specifically searching for trials across phase 3, phase 2, phase 1. And you can see here that we have different sections also on preclinical discovery, pipeline, and in general the venture academic innovation landscape. You can always go in and change those as well. So you can see here that for each section and each topic in the template, there's actually specific data sources selected. These are the same ones that you have access to as part of the Amass platform. So you can really pinpoint your data context for all the different topics here. But let's just go and start this as the example here for endometriosis. So I confirm the creation. The template is now running. You can see all the sections here are being processed that I showed you earlier in the template. I can actually leave here. I don't need to leave it running. I can go do something else. This takes maybe 10-20 minutes. And then I can come back to an output that I can immediately look at and make decisions on. So let me show you that. All right, great. So the template is ready now. You can see an asset that was generated for endometriosis that gives you at the very top, gives you the key bullet points you should be aware of before, for example, taking a further meeting with a startup working in this space. One of the key things in the asset is the swimlane diagram here that shows you in one plot the preclinical phase 1, phase 2, and phase 3, as well as approved drugs working on or targeting endometriosis patients. At the same time, you have a table down here that shows similar information, where you get an overview of what modality is it, what phase it is in, who's working on this, and what's the asset name, and also the mechanism of action. In this table, you can also search and filter. For example, Bayer is mentioned here. I can filter to Bayer and also select specific phases to show. And lastly, also export to both CSV and Excel. I can also export the swimlane diagram up here and take that further into, for example, a presentation that I'm showing for my team. Great. All this is based on, of course, traceable and reliable information, which is key to the Amass platform. So you can just go in if you want to know something about, for example, AstraZeneca or Bayer in this space. You can go look at the template and find the information there. The information is presented in kind of citing sources, references, papers, patents, and clinical trials, of course, directly on clinicaltrials.gov. That's it. That's how you use the Amass platform to get an overview of a clinical landscape around a target indication. And again, where does this help you? Well, it helps you to prioritize your best business opportunities, the best investment opportunities for you and your team. Everything I showed in the video, you can share with your team, which means that if you ever do a clinical landscape analysis, this will also be shareable, standardized, and reusable across your team, saving you well, for each one, hours, days, maybe even weeks of work. And thus allowing you to make decisions faster and focus on the right opportunities. Thank you for watching.